Now, a 33-year-old midwife has come in for a lot of praise for her selflessness and commitment in saving the lives of pregnant women and their unborn babies in hard-to-reach communities in the Ashanti region. Without access to an ambulance, the Delali Gavo of the local Motokrodua Chips compound has improvised the use of wooden doors to transport expectant mothers to health facility for deliveries. Ohiming Terry of our health desk traveled to the community to follow her exploits. Here's his report.
Motokrodua is a small farming community in the Sache East district of Ashanti region. It is one of the hard-to-reach areas in the district, with thousands of hamlets scattered in the thickest of a forest. Many of the settler farmers are plagued with many waterborne related diseases and other health conditions. Justice Ofori Amwa is the district director of health.
When you get to Motokrodua, it's a forest, and therefore you have a lot of these community members who live in the forest, in the hamlets. So you get to community A, you get about 2 or 3 people, you move to the next. So getting them is not so simple.
Many residents living below poverty levels cannot afford healthcare services and prefer home remedies. Pregnant women often suffer near-death complications as they fail to attend antenatal clinics. Some are delivered on their farms and others are transported to the Motokrodua Chips compound for attention by the only midwife here, Delali Gavo and her team.
Some of the cases we always attend to are snake bites, scorpion sting, malaria, diarrhea. We have communities such as Titikaso, New Apaso, and Pedra, Adukrum, that they are say. And the distance is far from where they are to the facility. So we do home visiting, get to the community, we attend to some of them. The serious one, we bring them to the facility to attend to them.
Lacking access to motorable roads, ambulance or other means of transportation for critical referral cases, Ms. Gavo has improvised and resorted to the use of wooden doors to transport her clients. 2 wooden slabs are joined with nails at the 2 ends of the door to support head pass. Patients lie in a supine position on the door and are carried on the head with the help of 3 men. This ingenuity has helped save many expectant mothers and their unborn babies.
This woman was so weak and was lying there. She mentioned some complaints to me that she's feeling lower abdominal pain and dizziness. That's why she's not able to walk. After the assessment, I realized that she's having a BP, high BP. Then when I listened to the fetal heart rate, it was very low. And I realized that water that the fetus was lying in was very green. So it gave me a signal that we can easily lose this baby.
20-year-old Zelia Yaya is among expectant mothers saved by this improvised wooden door ambulance. She had declined seeing an untrained traditional birth attendant in a nearby hamlet until Delali arrived. Thanks to the ingenuity of Delali, she safely delivered a bouncing baby girl.
I want to make cocoa macaroni. Madame Della. Friend one casano buy, but not can a penaying. And where is any impegate, imped 3, no more pedal, no more swamp. So I'm also could do cocoa be as no more brown or masu no more. Madame Della, Eda Fuku, Tido, ana me ame papa ana Kenneth ana Sakola omo so wa me call clinic mo.
And that's the story of Delali, Executive Director of Hope for Future Generation, an NGO in health, and a board member of the Global Fund. Cecilia Senu is on Zoom to join us for a very important conversation. Thank you so much for your time this morning, ma'am.
Thank you very much. Good morning to your listeners.
Great. Now, are hard to reach places being left behind in our country's health infrastructure development agenda?
Yes, listening to the stories now and reading what is happening, and also being an organization that works in the hard to reach areas of this country, they are being left out. I think looking at the fairness and distribution of resources, I think we are not doing very well with our hard to reach areas when it comes to health. I know there has been a lot of investment into health, but the priority should be the hard to reach areas.
And what should be done in the immediate to long term to fix this challenge that you talk about?
We are all aware of the challenges. No woman should die through giving birth or giving life to this world. And so when you listen to some of these stories, I think the government should really look at the resources that we need, especially in the hard to reach areas. Because I think when I listen, it seems vehicles are not easily accessible in those areas. And so as we distribute the 300 vehicles or ambulances that we have, I think we should first target those hard to reach areas where we don't have vehicles if we really want to achieve our universal health coverage as a country by 2030. Two, the people must be trained. You know, the woman she's so passionate. Listening to it is passion. And looking at what she's doing, those people who are in those hard to reach areas must be motivated to remain there. That is fine. First thing. The second thing is that they must have the equipment to reach out to people who need it most. I know the First Lady has been donating a lot of equipment to facilities, hospitals. I think that one important thing she has to do to help this country also is to target those hard to reach areas and support them. There are a lot of philanthropists, there are a lot of people who are willing to help. It must be a multi-sectorial approach to reach out to these areas and support. Private sector is very important when it comes to health care delivery. The country, the government must engage them. Look at how we put up a maternal health facility at Confanoche Hospital within a short time, where the first and the second lady, everybody come together. I believe if we target the hard to reach areas, we should be able to raise funds to help them. But immediately, ambulances must be deployed. The drivers must be trained very well to protect them, to support their psychological support, so that when they are stressed, they can also fight it, and then manage their stress level and support healthcare delivery.
In your work as an NGO in health, I want to believe that you have engaged either government or government reps in some of these hard to reach areas. What do you find is the reason why they are left behind?
I think one, it seems the resources we have for health is inadequate. Two, I think I will not say it's neglect, but it seems we focus more at the central and forget about sub-national level when we are distributing resources, because the national level is where everybody is there. And so those there are forgotten most of the time when it comes to distribution of resources. You talk to them, they are very helpless. I was at OT recently, OT region, and visited some of the facilities and then the hospitals, the sub-district, and you will really see that there is a big need of health, fairness in distribution of resources, because the people are willing to work, but they don't have the resources to work. So we must target them first where we have resources, and then before we come to the national level. That is what I think we should be doing.
I appreciate your time this morning. Cecilia Senu, is board member of the Global Fund, and she's been sharing her thoughts with us. Now,